You have to scan the room.
Oh, yeah.
Okay. First off, before anything else, I would practice my general principles and safety practices. And I would do my 11 rights of medication administration and my 3 checks against the MAR, and I would check the doctor's order, make sure everything adds up. And then I would go into the room, knock on the door, introduce myself. I would ask for the patient's name and date of birth and get 2 patient identifiers. I would make sure the patient doesn't have any allergies that we don't know about and that we don't have on record. I have all my equipment ready. I would raise the bed for good body mechanics, and I would do hand hygiene. Okay, and then I'm going to put my gloves on. Laughing at me, man. Alright, I've already done this a couple times now, so it's not sealed or anything, but I'll just explain it. Whenever I would come in, the first thing I would want to do is get the fluids ready to run, because that's what the doctor would have ordered. This came into a sealed bag, so I just took it out, and this also came in a sealed bag. But it had a cap on it here, and the spike had a cap on it. And you just take the caps off, and you got to be very careful not to touch them, and then you want to twist it in the downward motion to get it in. And then you're going to hang it back up, and you're going to squeeze the chamber to get it about halfway full of fluid, and then you're going to unclamp your line, and you want to prime it, run all the fluid through, then get all the air bubbles out. And then after that's done, I clamped it back so it's all set up and ready to go. After I got all that set up, I would do hand hygiene again, and I would put on new gloves, and then I would want to come in and try to find the vein. Can I see your arm, miss? I'm gonna put the tourniquet on. I'm gonna tuck it up in. I would do it tighter than that, but I don't want to like squeeze her arm off. Once I get the tourniquet in, and we're gonna like look around for any veins, like feel and see like where the best option is here. Once we find a vein, and I'm gonna use this here to show once you find a vein, and you can find it also by doing upward strokes. But I would find the vein, and then I'm going to want to take my ChloraPrep and break it and clean the site really, really good. And after you clean the site, you can't touch that area no more, and you have to make sure your patient doesn't touch it. And then I would go ahead and get my J-loop ready while that's drying. So with the J-loop, I'm going to take a flush. I'm going to put it on. And I'm going to prime it, run the fluid through. That way there's no air bubbles in it. And I'll have that set aside. So once this is already dried, we're going to take the IV catheter. And this is all, like I said, after hand hygiene and everything. And new gloves. We want to do it bevel up, and we want to do it at 15 to 20 degrees, right where we use that ChloraPrep at. And we're going to just insert it until we feel a pop. And once you feel that pop, that's when you're in. You'll see flashback. And then you just want to advance the catheter on in. Pull this out. And disengage engage the sharps. After I got that in, I would have held it here. Make sure none of the blood comes out, included it. And I would just screw this on while I'm holding it. And then I would want to pull back on my flush and aspirate and make sure I have good blood return. And once I see I have good blood return, then I'm going to go ahead and push the flush on in, which I'm not going to do it because it'll leak everywhere, but you would just push it all in really slowly. And I'm going to take this off, and I'm going to want to get a Tegaderm, which I have right here. And the whole time I was using the flush, I would have also checked the site just for any redness or swelling or anything like that, and make sure it's going in good. I'm going to get my Tegaderm, and you want to put it over the catheter right here above the hub here. And then, well, also, as soon as I got the catheter in, before anything else, I would have took the tourniquet off. And some Tegaderms come with something that you can put on the side here. That way you can initial it and date it and time it and everything. So I would do that, and then we would get extra tape. Where is it here? And I would just want to like tape it up really well, like closer around the hub. And then I would also want to tape the J-loop really good too. So I'm not going to be able to do the gloves on. Okay, I'll just tape the J-loop up, and then like I said, I could tape around that too. I would just want to secure it really well. After that's done, I will do hand hygiene, put clean gloves on, which I don't know if I can get these back on now, but what is it? Oh no. Good enough. I would want to take this and make sure that the fluids are set at the prescribed rate that is on the mower. So we would, unclamp it to wherever that needs to be, or if we had an IV pump, we would set it like that. And this would have a cap on it. It doesn't work. I've used it so many times, but it would already be sterile, and it would have a cap on it. For good measure, I would take an alcohol swab and I would clean both ports really, really well on both sides, and then hook it up while the line's unclamped. That way we can get the IV medication started. Again, I would make sure there's no signs of redness, swelling, anything like that, and ask the patient, make sure they're okay, they're not having any pain around the site. And then I would clean up my mess, go out, report, record, and evaluate later.